we'll get ready to get started in a couple of minutes.
And I'll remove the disclosure slide once you begin kind of introducing or welcoming.
Thanks, Bill. Noon. So we're going to go ahead and get started. Bill, thank you for the disclosures. Good afternoon, everybody. It'll be lovely to see your faces if you would so desire. So this is the first HPP for well-being in the year 2022. And what we hope to do today is to give a very brief recap of what our basic sort of framework is to address a culture of well-being and the reason for it, the evidence behind it, speak a little bit about what the future steps are, but really showcase the tremendous work that has been going on in the departments. And we'll start off with 2 departments today. We'll also take some time to hear very briefly a welcome from the leadership, both from Erlanger and UT, and their support for the activities that we are continuing to work together, especially when this current environment is so dynamic and uncertain, to say the least. So with that, Dr. Haynes just sent me a text message that he's on his way. We have Dr. Four, appreciate you being here, and we have Dr. Brewer from Erlanger. Thank you for being here. In addition, we have Natasha Og, who is your house staff leader, who will also be addressing. So with that, I'm going to just share a brief couple of slides. So our work started sometime in late 2017, early 2018, and we really have used the framework of the relationship valued unit, that everything that we want to do, whether it relates to a culture of wellness within the organization where we work, so that we can do what we want to do each day efficiently while we thrive and find meaning and purpose, is really also underpinned by the relationships that we have, where we bring out the best in each other so that we can do the best for our patients. So keeping that in mind, we've also used the Maslow's hierarchy of needs as a framework of addressing the various needs. We all know that we come here and we want our teams to function at the level of the top 2 tiers, where we are self-fulfilled, actualized, we have meaning and purpose, and we have connections with the work that we want to do. And we want to make sure then the foundational needs of the basic human requirements, food, water, rest, a feeling of connection and belonging to a community, are also addressed. So something that I've been having, informal meetings about are conversations. We've had these 2 questions that we have really honed in on, that what do you need to do your job each day, and what keeps you up at night? And very recently, we've also pivoted that given the second surge or the third surge and the ongoing issues with the multi-layered pandemic, really looking at, is this really just the tip of the iceberg, what is beneath it, but really stepping back and thinking about what really caused that iceberg even to form, and what would well-being look at this time, what can we do, and what questions that have come up for you. So in my informal meetings, these are some common responses from the healthcare professional team at large, not just limited to residents or students or faculty, but some nurses, some allied health professionals, some staff. So of course, for our learners is, am I going to be able to complete my training and complete it in a way that is going to be possible for me to work in the field that I want to do? Is there any purpose in continuing a fellowship or not? What does it mean to be successful? How is success defined? A lot of team members are asking, what is my role in making things better beyond the bedside? How can I make a difference? How do I support my team during these times? A lot of deep and deeper questions related to what did I went to this medical school or nursing school, or came into this vocation for a particular reason. Where is that now? Where do I focus on? And, what does control even mean? And then, of course, the major foundational one is, how do we deal with the stress, anxiety, and other mental health issues that concern us, our professional family, as well as our personal family? So then some of the other questions were, well, how do you feel with these questions that arise for you? How do you feel with these anxieties that you're dealing with? And, while they were the common feelings of feeling fearful, shame, confused, exhausted, uncertain, so on and so forth, there was also the positive feelings of, feeling like we're all in this together. It's a community. There's an empathy for each other. And there was also inspiration and a desire to do something about it together. So turning those challenges into creative opportunities as a community. So that was very encouraging to see. So as we move forward in our work together in a culture of well-being that we are looking to create, I would like us to really think about how we are in our relationships together. How do we show up? How are we there for each other? And what does that really look like? And we're going to turn to certain what I call recommendations to build that relational trust. But I think we all know these. We want to abide by them, but in the busyness and uncertainty, oftentimes they feel like they leave our framework. So how do we keep those in the forefront? And the common ones for that is, how do we truly listen? Another big thing is that, every few seconds I'm interrupted. We all know with patients that we interrupt a patient in less than 11 to 12 seconds. When we are dealing with work around making things better so that our common goal is achieved, how do we all realize that it's a puzzle that we're putting together and everybody has a piece of the puzzle and their puzzle is just as valuable and needs to be given that importance? Realizing that everybody has a different lens and everybody is different, and we need to be open to learning from that. And in this work, we are not looking for an easy fix or to react. We are looking at how do we come to a common agreement of what we want a culture of well-being to look like. We've been reacting a lot. How do we step back and say what has worked, what hasn't worked, and what needs to happen to make the difference we are looking for? We're all intelligent people with creative ideas. If we all agree, then there is no movement, there is no progression. So how do we agree to disagree in an agreeable way so that we can move forward with our creative ideas? And how do we look to other places who have maybe done this better than us, other industries, not even the healthcare industry, that may have done this work well, and build on each other so that we can come to a common purpose, a common goal? It's not going to be easy. We should be there to affirm each other and lift up each other when we, don't achieve the result that we need, because, if it was that easy, it would have been done and done well. And then, I think once we do that, we are really going to be in the forefront setting examples for others. So with this, I really want to energize you all to take this work and realize that each of you today here are contributing to that important work that we are doing together. We are all here to make sure that our patients get the best care possible, that each of us are supported in this environment, and all the learners get the best education that they deserve. So with that framework, I'm going to ask the leadership to say a few words. Dr. Haynes just joined me, and we have Dr. Brewer. So Dr. Brewer, would you like to go first? Dr. Haynes literally has just come in, so I'm going to let him have a breather.
Hey, Mukta and everyone else, thank you for the opportunity. I might be a stranger to a lot of the folks on the call. Dr. Doug Brewer, I came up from Macon, Georgia in September. I'm the Chief Medical Officer for Erlanger Medical Group. I am a trained colorectal surgeon, and I am so grateful for all of you. I am smiling because I'm also grateful for Dr. Four, because we know each other from the past, along with his wonderful wife. And also Dr. Panda, in terms of her leadership as it relates to physician well-being. I will share with you in terms of vulnerability that about 8 or 9 years ago, without recognizing it, I was the poster child of burnout. And it really, believe it or not, I'm glad that experience occurred, because it gives me a greater sensitivity to how important this is for all of us in terms of prevention, but then also support. So I can tell you that you all and this idea has full support from UTCOM and Erlanger Health System in general, to include the leadership. Thank you all. I look forward to the content today.
Thank you, Dr. Brewer. Dr. Haynes, our interim dean.
Sure. Good afternoon, everyone. Thanks, Dr. Brewer. I do also want to echo the comments that Dr. Panda and Dr. Brewer made. I think one thing to keep in mind that wellness occurs in our space of work. And I think it involves giving hope to others, whether that's your staff, your colleagues, your superiors, or obviously our patients. I hope that these series of events on wellness resonate. In some cases, I remember being in your shoes, although that was many years ago, and people speaking of these things that seemingly did not resonate to my immediate day. But in time, you will look back and say, I wondered why they talked about that so much. I think over the years, we recognized that quiet spaces, still spaces, thinking, reflecting matter, rather than just always moving to get the next thing done. And I would encourage you to try to find a quiet or still place before walking into a patient's room or an exam room, just to collect your thoughts before you go in, so that you can wholly devote yourself to the wellness of your patient, and in so doing, create wellness in your own space as you care for people. That's all I have, and thanks, Dr. Panda.
Thank you, Dr. Haynes. Dr. Ford? You may want to unmute, Dr. Ford.
I want to thank Dr. Panda and others for the sea change that I've observed in the past few years with our willingness and openness to talk about many of these issues that affect us all. we need to remember that the person that we're talking to at any given moment may be going through some issues that we have no idea what is going on with their life. And we need to always remember to value ourselves and understand that every one of us is the most important person in the world to somebody. And that's something that I think that we need to continually think about, that we are very, very important to someone else as they are to us. We're going to talk about individual wellness today and individual health, which is very important in the top of our agenda. But I also want to point out that our graduate medical education programs are well and healthy. We are all experiencing wonderful letters from the ACGME on a daily basis that are reaffirming the fact that our programs are strong and healthy. We're getting ready for a new match coming up in a few weeks. And the new match is going to bring us new friends and colleagues. And these are going to be strong people that are going to turn into great leaders. I want to congratulate our leaders here at Erlanger and in the College of Medicine. We've got strong leadership, beginning with the dean all the way down to our chief residents. So we have so much to look forward to. And I just congratulate all of you and want you again to remember that you are the most important person in the world to somebody. Thank you, Dr. Panda.
Thank you, Dr. Four. And in just resonating with what Dr. Four said, we will show you some collated data at the end of this from the Institutional Wellbeing Survey, the Faculty Wellbeing and Resident Wellbeing Survey, including information from what was uploaded on the WebEx for your program and the annual program evaluation. At the Wellbeing Task Force meeting and Resident Advisory Board meeting, we're going to give you updates that you can then share with all your departments regarding things like, the linen, food, and water. I just had a conversation with Ms. Rhodey a little bit ago, and things are looking favorable. And also some the IT. We're going to be talking with Dr. Sridharani and Dr. Cohen, who are now the new joint CIMOs for continuing the work with the EPIC and communication. However, we were wanting to lift up another possibility that we can do together as a college, but also elevate it to some extent in programs that already have that. And that is the buddy system that has been really borrowed from the Battle Buddy program that has been so successful. And to share a little bit more about that, I'm going to call on Dr. Amjad to share her thoughts.
Thank you, Dr. Panda. For those of you who don't know me, my name is Natasha Og, and I'm currently a third-year internal medicine resident and also part of the Wellness Committee. And I wanted to spend a few minutes talking about what's called the Battle Buddies system. And it's basically a program that initially was created by the U.S. Army, as Dr. Panda was saying. And more recently, Dr. Christina Albert came out with an article in 2020, and it's essentially a psychological resilience intervention. And the idea is that it's meant to translate to healthcare workers that have been faced with the COVID epidemic. And, as far as I can speak for myself and other residents, it certainly has impacted us in many different ways. And the intent of this particular program is to basically find a third party that can assign residents and really any healthcare workers to each other that may not necessarily talk on a regular basis. And the idea is to match people according to similar experiences and similar training backgrounds. And, each individual can actually rank folks who they feel comfortable talking to, and checking in with them 1 to 2, maybe 3 times a week. And it can be very brief. It can be as simple as a text message or a quick phone call, and really asking some key questions that we may not ask each other on a regular basis. And those questions include, what's hardest for us right now? What's something that maybe worried you today? What's something that went well? How are things at home? And what challenges are you facing with access to getting nutritious food, getting enough sleep? And, of course, that pertains to everyone, but especially residents and interns, that's really important for all of us. And having these conversations with other residents. And again, the emphasis is, we certainly tend to talk to our friends about all these issues, but maybe talking to someone that we don't normally do might provide us with a better perspective. And the last thing I wanted to kind of hone in on was these 3 pillars that this entire program really rests on. And those include anticipation, planning, and deterring. And the anticipation really focuses on being a little bit more introspective and figuring out, in a particular situation, can I anticipate what my reaction is going to be and how I may respond to a difficult situation at the hospital, or maybe being called in to work an additional shift? How is my emotional response going to be? And how can I plan to react to that emotional response? And having a conversation with your buddy about that in particular may be really helpful. And then lastly, deterring and knowing when to defer to someone who is a little bit more skilled in this particular field, specifically a mental health counselor, because the goal certainly of the buddy system is not to have that person be your therapist. It's really just to have a buddy. So knowing when to make that shift if things are more difficult and the conversation needs to be taken to a counselor is really important to know. So that's all I really had. Thank you so much, Dr. Panda.
Thank you, Natasha. And really, I really appreciate the very succinct and meaningful synopsis that you have provided. I hope this gives you some food for thought. We have some well-being champions from each department present also. We will be really putting together a program with the help of the members of the Wellbeing Task Force, which is all the wellbeing champions from each department, and the resident representatives on the Resident Advisory Board, and share it with the leadership before we disseminate it. So please be thinking about it. Provide ideas to your representatives, both the residents and faculty, so that they can bring it to our next task force meetings. I want to take a minute to really recognize all the well-being champions and coordinators in each and every department. I know you're doing this not just to meet an accreditation requirement. You're doing this because each of you believes and was selected by your leadership to be representatives from your department, and you are the role models for it. So thank you very much. And with that, I'm going to request and invite Dr. Amy Wells to share the curriculum from pediatrics thus far. All of this is a work in progress, but I think it helps us create a community of shared learning, borrow ideas, and perhaps even collaborate. And then she will be followed by Dr. Fox from the Department of Family Medicine. Dr. Wells, as far as I know, you have permission to share your slides.
Okay, thanks.
Thank you.
I'm really unfortunately bad with computers, so this may take me a minute. Let me just get out of, sorry.
You're fine, Dr. Wells, don't worry, okay?
It's not my forte. Let me see. Are you guys able to see my screen yet?
No, ma'am.
Hold on one second, let me see. Oh,
the green share screen button toward
There
the
we
bottom
go.
of your page. Very good.
okay.
Did it.
I know, it's amazing. Let's see. Slideshow. All right, so for those of you guys who don't know me, I am Amy Wells. I'm one of the staff pediatricians here. I'm also one of the assistant program directors for the residency program, and one of the wellness coordinators for our program. I was given the opportunity to help coordinate the wellness curriculum at the beginning of this year, and it's been a really fun experience. My background is military, so I have an interest in physician wellness from being in the military and from the stresses of that. And I think that this has just been a great opportunity to take on. So I just wanted to go through and kind of share with you our curriculum. I did some editing when I took over the program at the beginning of this year, and we're just beginning to kind of develop the program throughout. So can everyone see me? I just don't, my view is kind of funny. So let's see.
Your face is kind of cut off, Dr. Wells. Maybe you want to position the camera, and you're still on, you're not on slideshow yet. Yeah, that's much
That's
better.
what I was like looking. Okay, hold on.
Yeah.
Oh my goodness. My little.
If you go down at the end where you see the little full screen, that may help you. I think that's fine actually where you are right now.
Okay,
That's
so
okay.
so the goals and objectives of our program were really, I wanted to focus on what domains make up resident well-being, and all those domains include spiritual, social, financial, occupational, physical, and intellectual, environmental, and emotional aspects of our residents and of ourselves. I wanted to provide like really coherent like coping mechanisms and support during residency, and also provide resources for help if they needed it. So the way I was looking at this is, what can we do? What action items? What initiatives can we put in place? Some of them had already been in place, and then some of them are new things that we decided to do this year. One of the things that we've had in place for the past few years was doing a monthly wellness activity. And it wasn't always completely scheduled, but this year we've decided to schedule the last Wednesday of every month. The residents are excused from their rotations and for an hour, and then we do some sort of activity that promotes wellness. We also have provided some more structured didactics to teach about skills and about coping mechanisms in a more formal format. Also provided mental health services with our new resident counselor. We've also been scheduling debriefing sessions to talk about certain things that I'll go through in more detail later. And we've had in place our mentorship program and also our buddy program. The other things that we did that I can talk about with some more detail later are about the new resident lounge. We also have resident retreats and the resident like skip day that we put in place, which is a fun aspect of wellness. So I just wanted to talk some about our Wellness Wednesdays. This, like I said, on the last Wednesday of every month, we take an hour out of the day and we discuss a specific skill that promotes wellness, or do a specific activity that directly promotes wellness. Usually during the first part of the time we're together, I present a little life skill or some activity that we can do, and then we kind of do something more fun. So like for some of the things that we've done, for example, we did it like carving out time, like time management, and then pumpkin carving. We've talked about communication in the workplace, and then did personality testing and discussed how to work with different personalities. We've also done a really fun joint holiday feast with our family practice colleagues, and I talked about cultivating gratitude in the workplace. Some of the things that are upcoming are we're doing a nutrition segment and having someone come in and help us meal prep. We've done guided meditation before. We've done yoga, or one of the things. We're having a financial planner come. The last event we did, which is actually what the picture is from, is we did a community service project together and talked about an article that I had found about how community service and volunteering can improve most aspects of your health. the way I monitor the events are after each event, I do surveys so we can give feedback and hopefully make improvements that are needed. This is something new that we've recently implemented. We are doing debriefing sessions. After talking with some of the residents, they felt like they needed a more scheduled forum and a more scheduled place to like debrief about upsetting or traumatic events that may have happened in the workplace. And so we've started doing quarterly debriefing sessions that are held after didactics. And the sessions are set up with staff facilitators that help, that it's small groups, it's a small group session, and they're held by the staff facilitators that continually like lead these small groups. Our goal was to really have another support system in place for residents, another smaller group that they would possibly be able to feel comfortable talking to if there was, not just in this forum, but if other issues came up. And our goal was to have the staff involvement, to hopefully have some leaders in the hospital and in the department that they could go to if they needed some more support and feel comfortable. We also have our mentor program where residents are paired with the staff before even starting residency. And they serve as a mentor throughout residency for the resident. The mentorship, we provide mentorship training for the staff members, and we try to make them a little bit more accountable to make sure that they're really involved with the mentees. One of the ways we do make them a little more accountable is we have formal meetings twice a year to discuss milestones, and then formal evaluations are placed into new innovations. In addition to that, we just do monthly mentor lunches that are pretty informal and fun, and everyone enjoys. Also, with our mentees know that we have an open door policy. We talk to them offline about certain things, and we've been doing this for a little while, but it continues to grow and to become more involved and improve, hopefully. Another thing that we've been doing is we call it the buddy program. It's just another way to provide support to new interns. Before interns start residency, they're paired up with an upper level resident, and they're thoughtfully paired up. It's not just random. So we pair them up with hopes that buddies will mesh well, and that it will just be another support system for new interns. And the buddies connect and reach out to them even before starting residency. Let's see. So one of the fun things I wanted to talk about is recently our pediatric resident lounge was renovated, and with some of our budget from last year, we bought a variety of items that help with stress management that are put in the call rooms. We put yoga mats, videos, adult coloring books, things that can be used on call, things that can be taken with them to their call rooms. And also this Christmas, the faculty donated money to buy a very fun, fancy massage chair for the lounge that, as you can see, one of our residents is enjoying there. So I just wanted to briefly go over also the surveys that we use after the sessions. We do them after all the wellness events and also after the debriefing sessions. And so this is an example of one of the surveys that we put out. It's basically they scan a QR code, and so hopefully makes things really simple for them, because surveys are notoriously difficult to get back. So hopefully it makes things a little bit easier. And then they covers what areas of well-being that they thought it covered to get a little more detail. And that's it. I don't have anything else. Do you guys have any questions?
Thank you, Dr. Wells. As you all can see, it's really robust and it's fun, but also meaningful, so that there are skills while having a fun time. So making work or finding time to play at work is, I think, what also helps with the well-being. So thank you very much. How about I invite Dr. Fox in the interest of time, and then open it up for questions for a little bit with both Dr. Fox and Dr. Wells. Dr. Wells, once again, I want to applaud your leadership in this. It's a really very robust program.
All right. Thank you, Dr. Panda. And sounds like you guys are doing a great job over there in pediatrics. My wheels are spinning about how we could do some things together, because there's lots of overlap. Can you guys see that okay? All right, so I'm just going to talk about wellness at UTFP with like a lifestyle medicine slant. So a little bit of background about me personally. Been a family doctor, graduated from the program here in our department back in 2013. And I've been faculty ever since. Back in 2018, I pursued certification in lifestyle medicine. This last year, we formally integrated a lifestyle medicine curriculum, which is provided by the American College of Lifestyle Medicine. I'll have some resources at the end if anybody wants to check out the website, which I would recommend. So what does lifestyle medicine really focus on? It's a lot of the same sort of wellness initiative buckets that Dr. Panda is trying to promote here. But certainly nutrition, sleep, exercise, avoiding risky substances, stress management, and then also an emphasis on healthy relationships and building community. And there's lots of sub-lettering there that you can see about sort of plant predominant food in terms of our nutritional goals that we're trying to promote. Why do we care about these things? Well, when we integrate, the more of these that we integrate, the better our health is, lower absenteeism is, more engagement, better focus, higher energy, higher productivity, a lot of the things that we in the medical field seem to pride ourselves on. And so I think wellness is definitely a gateway to get there. So like I said before, our department has joined in this national movement to integrate a lifestyle medicine curriculum into our current ACGME required curriculum. So it's sort of above and beyond and sort of woven into the ACGME requirements that we have. But you can see this is just a snapshot of the country. As it currently stands, there are 49 different sites that are participating in this nationally. And one thing that I really wanted to point out is that you can see that there are 49 sites, but there are 82 programs. So what that tells you is that multiple sites have had multiple programs participate in this. And I'm certainly going to put a plug in there for any other department that's interested in sort of joining this in this curriculum. I think it'll make all of our lives a little bit easier. So it's not a huge lift. And hopefully after we get through an entire year's worth of running through the curriculum, we'll gain a little bit of wisdom. So again, I want you to hear me inviting any department that's interested in joining in, like, come to the table. Love to chat with you. So what does the curriculum look like? It really covers 40 hours of didactics that we've decided to do a 24-month implementation model, so we get through all of the lecture material 1.5 times through our 3-year program. And then there's 60 hours of application, and this is really done on an individual or group level. And this is where some of the wellness activities that we have done as a department sort of check the box on multiple individual activities. We've done a yoga class here as part of our Wednesday didactic time. We've did a whole food plant-based cooking class with a local institution called My True Health Journey, and tried to learn 3 dinners, 3 lunches, 3 breakfasts, and a few snacks in about 3 hours. So it was a whirlwind of an event. And we also had an acupuncturist come down just to sort of open our minds, give a little bit of hands-on experience with some of these wellness activities and show how it can really be possible, and maybe breaking down some of the barriers people would have to just trying it. So it's 100 hours collectively between didactics and then those individual activities. But we also want people to integrate this into what they're doing as they see patients. So there's a portion of this which is really about internal wellness, but then we also want to share this with our patients. So throughout, to meet the program requirements, you have to have 400 patient encounters that are documented. with multiple subtypes of interventions, whether it's nutrition, physical activity, tobacco cessation, a lot of the things that we're already doing, just with a little, do it a little bit better. And then the most difficult thing to capture in this program is these group visits or intensive lifestyle intervention programs, which we are currently trying to build within our department in a billable, sustainable fashion. So more to follow on that. And if anybody has expertise or wisdom in that arena, please give me a call. So I'll just leave it with these resources here. So again, the American College of Lifestyle Medicine is a tremendous resource. There's lots of online CME centered towards individual wellness if you want to get some CME and invest in yourself. If you want more details about the residency curriculum, it's also on their website. And if you have any interest at all in potentially expanding this program across multiple departments, I left my email as well as my personal cell phone number. And yeah, we have not formalized a lot of these programs. I just recently joined this task force about 3 weeks ago. So looking forward to diving in.
Excited to have you, Dr. Fox. Thank you very much. As you can see that, there are different ways. And if you've seen one well-being program, you know what works best for you. But I think there's a lot of opportunity for shared learning and collaboration as we build together that community of well-being within the organization as a whole. So with that, are there any questions for Dr. Fox or Dr. Wells?
I have a question for Dr. Wells. You look muted now, so there you go. You talked about on the subject of debriefing. That's very interesting. And you talk about staff facilitators. Mm-hmm. Who are these staff facilitators, and how do you know that they are prepared to do what you want them to do?
So we specifically picked certain staff out and asked them to be part of the debriefing sessions. It's the same staff potentially the same staff for each session. And we prepared them with kind of a format of what we wanted it to be, more of an open session. Our Dr. Garcia, our program director, all these people we had met beforehand and kind of discussed our goals for the debriefing sessions. And we didn't want it to be super formal. We didn't want it to be, go through these patient cases. We wanted it to be an open forum for the residents to talk about things that have happened, whether it was a bad patient encounter, whether it was like a bad encounter with another staff. And so it's led by 2 staff facilitators, and it's and we divide the residents up into 3 different groups and each group has 2 staff facilitators. And then we basically write, I kind of, if the conversation is stagnant, which the last one, it definitely was not, there were lots of talk. I wrote out some questions that could be asked to kind of get things going, I guess, so to speak.
So some of our staff facilitators have been, usually we try to pick someone from the inpatient floor, someone from the NICU, someone from the PICU, someone from our HEMONC service. Sometimes I think we're looking at trying to reach out even from our ED service because we're trying to pick out the people where bad things happen, right? And it's usually in these locations, and these are the people that have the experience and have learned how to cope with these bad experiences. So a lot of time it's just them sharing about themselves also and how they have learned to cope with some of these bad experiences. And it's, again, shared learning. We learn from each other. And by listening to somebody else, we think, oh, next time when I have that experience, I'm going to try to use what Dr. X did and see if that helps me with that experience.
Dr. Garcia, I think I have had the same question that Dr. Ford did. And so if I understand correctly, Dr. Wells and Dr. Garcia, the staff that you're referring to are faculty staff, correct?
Faculty staff, yes. We have 2 NICU doctors.
That's what I was.
Sorry.
We have
2 NICU doctors and somebody from the PICU, somebody from a staff inpatient on this floor. We also have our peds psychologist who works out of our clinic is one of the facilitators as well, and
Gotcha.
I am. So
Okay.
Yeah,
No,
no,
thank
thank you. I think Dr. Brewer has a question. Before that, I think what you all are doing has definitely shown to be very important to create that safe space and involve actually the staff could, like you said, this psychologist, but also the whole one person from the allied healthcare team or other members of the team that was in care of the patient. That was the part of the Schwartz rounds that we used to have over here. Which we hope we can get back. Dr. Brewer, you have a question?
Yeah, thank you. Interestingly, as a subspecialty surgeon, I am interested and applaud what Dr. Fox has done with lifestyle medicine as we pivot to, value-based healthcare delivery and really focus on wellness and maintenance thereof. A lot of those things center around social determinants, and we've got so much work to do in terms of health disparities. So I'm interested in plans or current processes that you have in place to connect to community social services for our underserved population. Thank you.
I'm assuming that's maybe directed towards me, and I'd love to take that one on. So my current plan, in partnership with the YMCA and the Hamilton County Medical Society, is to launch a Blue Zones project. And we're having an event that UTC is hosting on April 27th that we'll get flyers out about, but it's basically to create an enormous citywide coalition amongst hospitals. We're reaching out to all hospital systems in the area, major employers, mayors, nonprofit organizations, faith-based organizations, to try to sort of crystallize or align all of our efforts, get people out of silos, and see if we can transform the city. Now, how that addresses health disparities is it tends to try to make the healthy choice the easier choice, sort of the automatic choice. So people can take an individual pledge, but we're hoping that we'll improve the health of the environment so much that people will, just by living in it, will get healthier. That tends to benefit the underserved population the most. And the Blue Zones has a great track record across the country at multiple different large cities. And you can also go on their website, bluezonesproject.org, to sort of get an idea of what we're trying to do here. But certainly, I think trying to handle the social determinants of health in our clinics is just not enough. So it has to be a community-wide effort to sort of bring up the baseline. It's hard for me as an individual, lifestyle medicine provider to send people out into the wild, knowing that they're going to be swimming upstream against the unhealth that's sort of being thrown at everybody in our community. So if anybody's interested in Blue Zones Project, looking for all the help that I can get. I've never tried to launch a community-wide event, but we've got some great partners so far, and we need as much help at the table as possible. So I'm dependent on everybody in this hospital system to be able to launch this well. And that's all I'll say.
Thank you.
The question.
Yeah, if I could just pipe in, Dr. Brewer, we're going to have a series of meetings February and March where each residency program director is going to present what they're doing in the healthcare disparities space, and then try to converge and see where we can collaborate and cooperate with one another to impact our community. So that'll be forthcoming. And also those meetings will be chaired by both Dr. Joni Jack from Pediatrics and Elizabeth Appling from Erlanger.
Thank you all very much. So moving forward, we have collected quite a bit of data. So very quickly, we'll just show you the format of the data. We are not going to go through all of it today, but I'm going to have individual meetings with the UT leadership and each departmental leadership to go over their departmental data. So Ms. Scott, can you just briefly share the spreadsheet, please?
Yes, ma'am. Can you see that right now? This is a spreadsheet that collates the various resident. This is a resident well-being survey that was done in the spring of 2021. We've got the information by program. These were the well-being questions that were asked in this section. And this graph right in here is our institutional data, comparing 3 years from 2018-19 through 2021. And I believe next month opens up the window, or possibly the end of this month, opens up the window for those surveys to be distributed from the ACGME. We need you to carefully look at those questions and answer them honestly so that we have good data. You can see that institutionally, our residents do very well on this line. Anything that is green means that we meet or exceed the national mean for those questions, which is good. The 3 negatively worded questions, we have 2 areas where we're just a 0.1 off the national median. So overall, we're in pretty good shape. Let me look. We have similar data for the faculty responses. And again, Dr. Panda will show this in more detail to all the departmental well-being leaders. So thank you for participating, and we want you to be prepared for the upcoming surveys.
Thank you, Pam. And
pardon?
Sorry, I said Pam's done a real incredible job putting all this together. It's not been easy. And then also there is another spreadsheet that looks at the data from the web ads and the annual program evaluation that also is by each program, which gives a little bit more in depth about what you all are doing in the well-being space. So hopefully next month we will start these meetings. There've been other pressing responsibilities and clinical demands, so did not feel that we should interrupt that at this point. So I really would like all of us to thank Ms. Scott. This has not been an easy task for her to put together with all the other things that she's responsible for. So thank you, Pam.
You're welcome. Glad to help. Thank you.
All right. So I'm going to just share some more data and then give the floor to Jessie, who will share some information with you all. So as you all know that we have been really fortunate to have Jessie Kelly with us. And she's been here only since October. And as you can see that till last month, she's really made tremendous impact. I want to say thank you to the leadership of each department for really normalizing the culture where we have a space to be who we want to be with all our vulnerabilities while we are at work, and really want to publicly thank Jessie for being so available and accessible to everybody. So thank you. This is the data by the departments. As you see, some departments have utilized more than others. These are residents, students, faculty, staff, everybody, not just limited to residents. Again, this is another way to share the same graph. In addition, I wanted to share other things that she has really been working on. And just again, to remind everybody, she's only working 50% of the time, but she's already developed some policies that we can have in place that helps us with this work and really is sort of codifies this more legally and has worked with the similar center in Memphis. We're working on a feedback survey. We haven't really finished that yet. We want to honor the anonymity, but also want to get ideas on what needs to be improved, but more importantly, also what is going well. The Department of Urology has already asked her to come and do regular sessions for their scheduled didactics. So just to let you know, these are some topics that she's going to be presenting. She is available to each of your departments for similar work if needed. And we're doing this today. She's going to talk a little bit about some practical skills. And then we are now looking at how can we also offer educational resources for educational coaching so that, anybody, how does our well-being or lack thereof impact who we show up as learners, and what can be done to assist with that? So we're really excited that she will expand her expertise to this. So with that, Jessie, thank you very much. We really appreciate you being here. And I want to hand it over to you now.
Okay, thanks, Dr. Panda. I'm just excited also to be here. Just being mindful of the time. I have about 6 or 7 things to share with you guys. If I end up going over or need to stop, please someone let me know if you don't mind. I get really excited just sharing information that can hopefully help you guys. Easiest thing to cope is just to deep breathe. I know that's so cliche to say to do deep breathing, but being really intentional about that breath can help move you out of that sympathetic state. The easiest way to do that is to inhale for 5 seconds and then exhale over the same amount of time, or whatever feels comfortable for you. When I feel particularly stressed, I hold tension in my shoulders and my neck. And so sometimes massaging any areas of your body where you're noticing that you're holding tension can also help release that tension and help you feel a little bit calmer in the moment too. Another really good tip, of course, is exercise. I have done like squats or lunges or something in my office when I just feel like I need a burst of energy. It sounds counterintuitive, right? I'm really tired. I don't have any energy. Why am I going to exercise? But it really does just help give you just a burst of energy to help move through your next task. Another good tip that I like to share is cold water. Obviously, you can't go take a cold shower whenever you're on the floor doing rounds or just during your work day, but splashing cold water on your face, or if you're feeling adventurous, you can dip your tongue into some ice cold water. That cold water can help reset your nervous system if you're hovering in that sympathetic state. It just helps for a good quick reset. Probably one of my favorite ways to reduce some stress is just to connect. Connection is the quality of that parasympathetic state where you want to be, where you feel calm and you're connected to yourself and other people. So go connect with somebody. Particularly if you trust someone, that connection is going to be a little bit stronger there. But any connection will help relax your nervous system. And it also creates opportunity to laugh, and laughing is just a natural stress reliever. So go laugh and, get some of those feel-good endorphins going in your body too. Let's see, I think the next one is meditation practices. My favorite way to meditate is using imagery. So just think of a time where you didn't feel stressed, you felt at least neutral or positive feelings and sensations, and just think about that. When you do that, especially if you're in a feeling of stress, you're going to help reroute those neural pathways to more positive feelings, positive thoughts, positive sensations. And so that, of course, will help you feel calmer just in that. And the chart that Dr. Panda has shared is called EFT tapping. All of these things that I'm talking about, they're all backed by research and science, and there's been plenty of studies that have been done on all of these. But EFT tapping stands for Emotional Freedom Techniques. And what this does is it sends calming signals to your amygdala by using acupressure points that you're in your body. And what I really like about this is it's using your brain and your body, like resources that you already have within you, to help restore that body and mind connection. Because again, going back to connection, When we're disconnected, we're going to feel dysregulated. So anything that you can do using your brain and your body to reconnect is going to help that nervous system relax. And the biggest thing that I want to say about coping skills is to practice. It's really important to figure out what works for you, because my coping skills are not going to be the same for you. So you can really play around with it and have fun, because when you're in a period of stress, it's going to be hard for you to go through a list of coping skills that you have in your head. So practice is probably one of the most important things about coping skills, and understand what your body needs, what your mind needs to be able to relax in those periods of stress. I'm open for questions. If anyone has any, I can certainly share some more of these resources. I can be reached by phone or email. And I think we're out of time, so that is all that I have. Thank you.
Thank you for those practical tips, Jessie, and thank you again for all you do. Are there any questions or comments? And as you all are thinking about that, I want you all to do a couple of things. One, I want you to put in the chat, what are your feelings currently? And if you don't want your name to be seen, hover on your virtual square where the blue dots are, and you can rename yourself to be a dot or a number, and nobody would know. So if you're uncomfortable sharing with your name identified, you can go ahead and de-identify that, but just put in the chat any feelings that you are having after our conversation and time together. I would love to see the chat box light up. Come on. This is your community. Some of you all are texting me directly. That's fine. I appreciate that too.
Some really positive comments. Thank you. Appreciate those. And thank you to all the speakers who've shared information today. We really appreciate that. I look forward to another one of these sessions and hope that you will as well. Appreciate you taking the time to come.
Thank you. I put some of the words that I got in my chat directly. Thank you all very much. Have a good rest of the day. Are there any other questions? I'm available if anybody wants any other information. Thank you, Bill, for the QR code for CME.
This is for CME credit, in particular for those physicians who need to have documentation for their CME credit earned. Thank you, Bill, very much. I hope everyone has a blessed and terrific day, and feels like this has been a positive time to listen to others and to reflect on some things. Okay, be careful out there. Bye-bye.
Bye. Thank you.
Thanks.